Welcome to our first episode of PCOM Perspectives. I'm your host, Dr. J. Feldstein, and today we're talking with Farzaneh Daghigh, Director of the Gastroenterological Science course in the DO program, about our new Culinary Medicine elective for DO students. The elective is based on the pioneering curriculum created by the Goldring Center for Culinary Medicine at Tulane University. Dr. Daghigh co-directs our elective with Dr. Joanne Kakati-Monzo, Professor and Chair of OBGYN, and our catering director, Bud Cohen. Welcome, Dr. Daghigh.
Thank you for inviting me.
Could you explain to our listeners how the class is set up and what the students are doing?
The class is set up based on a team-based learning approach, which is called TBL. And the curriculum is set up so that the students get a chance to work on a set of information. It's a basic medical knowledge based on nutritional-based, evidence-based literature, where they review some research articles. They actually review a video, PowerPoint presentations, and then they take a small quiz. So that's a requirement for them. It's a pre-class requirement. And then when they come to class, we gather together in a group and we actually answer their questions. So Dr. Kakati-Monzo and myself answer any questions they may have related to the quiz. And then we put them in groups of 3, where they actually review and look at certain cases that they're assigned to. And these cases are clinical cases related to nutrition, and they have board review questions after each case. So they get a chance to sit together and go over these cases. After they're done that exercise, so it's the fun time. So they go into the kitchen where Chef Bud actually gives them some basic culinary arts concepts and information. So he reviews certain skills, kitchen safety and sanitary information that they need to know before they start. They go over the recipe with us and with Chef Bud, and they get to work. So it's the fun time at that point. After they're done working on their recipes, we make them to plate their meals in a serving, 1 serving per the meals that they made. So one of the activities that they do is we have a buffet set up and they go over their recipes. So to discuss what is the nutritional value of each meals that they prepare. They talk about the fiber content, the fat content, the proteins and sugar content of each meal. Sometimes they get to see how small changes and conversions of one ingredient in each recipe and compare it to the next group, how that makes a difference in the value and nutritional and nutrient values that that particular recipe would have. So it's a very hands-on approach in which they're able to compare different inclusion of different fruits and vegetables, for example, different types of fibers in their recipe, and realize that by those inclusions they make a better, healthier meal, and they actually have a lesser calorie for per volume of what they serve. We discuss the cases. These are the clinical cases that they earlier had a chance to work on as a group. And at this time, we go around the table, we answer questions, and we go over the cases. So they really love that part. I have basically done a lot of different active learnings, but this is one of the more effective types of active learning. And we really do see the students enjoy the discussions because they get to gain an understanding of how culinary arts, based on and as well as their medical knowledge, all together tie in to provide them with some information that they already did not know about culinary medicine in general.
How do you think this format compares to a typical lecture?
We do these sessions 4 times a week. We have about 48 students signed up. Initially, when we announced the course, we in a 3-hour period, we got about 137 students signed up in the first 3 hours.
Wow.
So the students are very excited. This is a tangible format where the students have a hands-on approach and are able to relate the medical knowledge that they have to the classroom information that they get as far as culinary arts and nutrition education that they get. So students are ecstatic to be there. They sit for the discussion questions, and nobody leaves until we tell them it's time to leave.
That's great. Do you think we'll get to a point where we'll be able to accommodate as many students that want to take the class?
I certainly hope so. It is one of the formats that I think it's very reliable in the fact that the students like to be there. When there's excitement in learning, I think it's an effective type of educational model.
Can you talk about how nutrients can affect the body in different ways?
So the impact of diet and nutrition in treatment and prevention of certain illnesses have been documented in the literature. I'll give you 3 examples. One is the large study that's called Lion-Heart study that proved that diet is a cornerstone of cardiovascular disease. The data suggested that an increase in polyunsaturated and monounsaturated fatty acids and a decrease in saturated and trans fatty acid would actually be cardiovascular protective. This was a large study, and based on this study, there were recommendations that were made for patients to change their diets. So they showed that also participants who followed a Mediterranean diet had a 50 to 70% reduction in the second episode of a heart attack. The next study is based on the DASH diet, which also showed that there's an improvement in patients who have hypertension. With this diet, they showed that a participant who had a first stage hypertension and followed a strict DASH diet had a significant reduction in their blood pressure when compared to participants who had a SAD diet, that is the standard American diet. The next diet is something that we reviewed in this course, and it's the anti-inflammatory diet, which is an adaptation to the Mediterranean diet. And this diet have been shown to improve disorders of chronic inflammation, which is known as a silent killer and plays a role in almost all of the top causes of mortality in the US, from atherosclerosis to RA to Alzheimer's disease. Dr. Feldstein, why did you decide to bring the course here to PCOM?
I think one of the cornerstones of a holistic philosophy of which the osteopathic profession is built on is preventive medicine, and a large component of preventive medicine is nutrition. And when I looked at our curriculum and talked to you and talked to other basic scientists, it seemed like there was an opportunity to add more nutrition from a clinical standpoint to the curriculum. So we tried to figure out what was the best way to do this, because we know medical students are overburdened in the first 2 years. So we came up with the elective concept. I looked to see what was out there, and Tulane had developed this really interesting culinary medicine program that I thought we could adapt to our curriculum.
What is the importance of nutrition in primary care?
I think the biggest challenges in primary care today are the treatment, prevention, and management of chronic diseases, of which obesity, hypertension, and type 2 diabetes are basically epidemic in our country. So what better way to try and prevent and treat those diseases than by giving our student physicians a firm foundation in clinical nutrition, so that when they go into practice, whether it's and through their residencies, they can be more effective.
Why do you think a doctor should know how to cook?
I think everybody should know how to cook. But from a physician's standpoint, I think it's really important for medical students so they can understand how their patients eat, because food is such an important part of nutrition and our culture. It's a way for students and physicians to relate to their patients. It's an opportunity to have a conversation, and how changing small ingredients can really change the nutritional content of a meal and really help patients in terms of preventing obesity, preventing type 2 diabetes, and managing their hypertension without medications. I also think it's fun. It's a way to build camaraderie in a class. It gets them in a team-based environment, which is more and more important in healthcare today. And I think it's fun. And it's also good for them as students, as individuals, to learn healthy eating for themselves, because medical school is a very stressful time, and nutrition and proper eating is part of the management of that stress. So it's really a holistic philosophy for our students, as well as being active professionals in primary care or whatever specialty they go into. Thank you for joining us today, Dr. Daghigh. For more information about the Culinary Medicine program at PCOM, visit pcom.edu/news. I'm Jay Feldstein, and this has been PCOM Perspectives.